Hey guys, I'm Dr. Ruth Roberts. I'm the creator of the original Crock Pet Diet, coming to you live today. I've got a couple of really interesting topics to talk about, but I do want to remind you about the Animal Wellness Summit. It's been ongoing. Today is the 6th day. The last day will be the 20th, which is when I'll be making my presentation about home-cooked foods. The summit is completely free for the 5 to 6 sessions that are present for that day, and then there is an all sort of a year-long access you can purchase. And frankly, I think this is going to be extremely useful. Glad you guys are enjoying this. Man, really a lot of folks on today. This is awesome. 53 people. This is like a new record. Thank you guys so much. I cannot tell you how much I appreciate this, and glad we can get the message out. But go check out the Animal Wellness Summit. I'll put a link down below and let you guys know where you can sign up to go check it out. And man, this is fantastic. So Jennifer, Grace, Barbara, Andrea, hey, how you guys doing? Glad to see you. So today Dr. Dodds is speaking, and if you do not know Dr. Jean Dodds, she is one of the people that brought holistic medicine ideas into mainstream veterinary medicine and established that there is indeed a connection between thyroid function, and in particular in dogs, low thyroid function, and the rabies vaccine and other vaccinations. So she is an amazing speaker. She has done so much in veterinary medicine to help animals. So go check out the Animal Wellness Summit. The upside of their app deal is that they will be able to give you access all year long to the presentations, but also you'll be able to jump on for question and answer sessions and many other goodies that Barney hasn't even divulged as yet. But I think that's actually going to be an extremely good investment at $147 for year-long access plus the opportunity to ask experts more info. And Nikki, thanks so much. I'm glad to hear this is of value to everybody. So a couple of things we're going to talk about today. One is there is this super cool device I saw that's for people, but it's for people with opioid addictions. The thing that is awesome about it is that it uses acupuncture principles. In human medicine and in dogs to some degree, there's but humans it's better diagrammed out about points that are in the ear. And so this thing looks like a little hearing aid you would stick down here, and then it's actually connected to 2 or 3 points in the ear, which helps to convince the brain that really, no, you don't need that other pill. You don't need that other shot of Oxycontin. So I'm going to put a link to this thing down below in the comments, but it really is a beautiful piece of technology that incorporates modern ability and modern technology with an ancient medical practice. So that's fantastic and great that everything is starting to kind of combine together, which is awesome. So I had an email from Jan and Mark, who were clients at Sundog Camp Moon, and they were, they had this beautiful dog named Lizzie, and Lizzie is a golden retriever. And unfortunately, she developed cancer, as many Goldens do, and after a long period of time, we were able to keep her happy and healthy for many, many, many months, and then finally she lost the battle. They've gotten a beautiful 1-year-old Goldie, and he's now about 68 to 70 pounds. He's very active, and what they're not sure about is how much to feed. So he's eating like he's never seen food before. And so is that normal? Do they need to feed him more? Do we need to feed him less? What do we need to do here? So in previous live sessions, we have had, I've been able to post the body condition scoring system, the World Small Animal Veterinary Association. If you Google that, you'll find these. So your goal for a young dog, especially a dog that's prone to hip dysplasia, joint disease, things of that nature, you want to keep them super lean until they hit about 2 years of age. And the reason is that that way we don't end up with too much pressure on the joints. And so in doing that, you want to keep them lean. They're going to be hungry there's a couple of techniques you can use. And so if you find that your dog is at a perfect 5 or a 4 for a younger dog, especially the larger breed dogs, then you may need to add some more food. And so a good rule of thumb is to take the body weight and multiply it by 15. And that will give you the total number of calories that that animal should require for the day. And that's a wee bit on the low side because, frankly, most of us and most of our pets are couch potatoes. You can bump that up if they're super active, but that's probably appropriate, especially for a large breed dog. So for Sammy, then that would mean he would get somewhere around 1,050 calories per day. And the Crock Pet Diet, on average, is about 250 calories per cup. So he may need somewhere between 3 and 4 cups total per day. Another option is to add a little bit of extra fat. So roughly 1 tablespoon of fat, whether that's coconut oil, olive oil, avocado oil, tallow, lard, that sort of stuff. It's about 120 calories per tablespoon. So that's another great way to get their calories taken care of. So, and then if you look at that body conditioning scoring chart and you find that they are actually a little towards the heavy side, but they're still eating like, there's no tomorrow, then one technique you can use is to actually take either a baking pan or something like a 9x12 baking pan, so something like this, or a cookie sheet, and just spread the food out. So they have to really kind of take their time to eat a little bit more. You will want to elevate this so that they're not sucking in a lot of air with the food. And then the other thing to be cognizant of is bloat. And while that's mostly a problem in large breed dogs like Great Danes, it can be for any dog. So elevating the food reduces the amount of air that goes in. And then the other thing that actually is really important is to not let them tank up on water immediately after they've eaten. And with the Crock Pet Diet, it doesn't seem to be an issue because there's plenty of moisture in the food, so they generally do not go and drink a ton of water afterwards. Versus with dry kibble, they need all that water to help them digest that stuff. So be cognizant of how to kind of slow things down a little bit if you need to, and take it from there. So let's see, there's a question back here. Let me see if I can find that. And Dan was asking about his little princess who got spayed last week and she's not eating, Princess Grace, and that's perfect. And if it's been a week, she should be eating by now, so something is not quite right going on there. So, I would definitely take her into the vet, just get them to double check the incision, make sure she's not running a fever, having an infection, something of that nature. And then also the big thing is pain control. Is she not eating because she hurts? So that's a major question to ask, and that's sort of a symptom of pain that we typically don't think of. Often they're also licking at incision and things of that nature. So Dan, check that out. Talk with your vet though. If it's been a week since she's eaten, that's not a great thing. And then the other thing you may need to do is offer something delicious and fantastic. Conversely, if she's on some pain medicine or antibiotics or other medications that can also be making her nauseous, that may be why she doesn't want to eat. So talk with your vet, make sure what's going on, so that we keep Miss Grace happy. And Alicia, good to see you guys. Really, I just can't believe everybody is on. This is really awesome. Very exciting today. So the other thing I want to talk with you guys about is dental care. So as many of you know, I've had a great number of health issues I've been dealing with this year, including inflammatory bowel disease and C. diff and SIBO, which is not fun. Thankfully, I'm getting to the edge of things. But there's a company called Ubiome, and go check this out as well. You've probably seen ads for it on Facebook. But what they are doing is sending you a complimentary kit to find out what your microbiome is. And the microbiome is all the bugs that live in our guts that do the heavy lifting for us as far as controlling inflammation, creating appropriate neurotransmitters and things like that. So the idea is that if the good guys are in charge, everything's good. The bad guys are in charge, we need some help. And the awesome thing is that I think this company is trying to make this understandable to doctors that are in conventional practice, especially gastroenterologists, so they can actually help their patients with this. So for me, the good news is that my microbial diversity was actually normal. Yay! Because there weren't any good guys in my gut 6 months ago. So that was the good news. The bad news is that there's a bug called Fusobacterium that's supposed to live in the oral cavity. So in people, and pardon me because Esau's decided he needs to tell the world about things right now. In people, this bug, and I think he's trying to help us keep the evil spirits away. So let's walk over and see if we can get him to be a little quieter. And Esau! Whoa, what? Oh, sorry. He's also deaf, so he can't hear me calling him until I get pretty close to him. But So the thing that's interesting about Fusobacterium is that, pardon me for all that movement and craziness, hope that wasn't nauseating, is that it is supposed to live in the oral cavity. And it is now associated in humans with not only inflammatory bowel disease and is a precursor to colorectal cancer, not so good for me, but I'm going to work on this. But it's also associated with everything from decreases in fetal viability, so losses of pregnancy, miscarriages, things of that nature, atherosclerosis, all sorts of stuff. So the vast number of diseases that we're dealing with as people, this thing is bad news. But where does it come from? So I said it's an oral pathogen, right? Well, guess what? I have 3 root canals. And I went back and reviewed my x-rays from this winter, and lo and behold, one of them clearly has a periapical abscess, or an abscess right at the tooth root, and that root canal has actually failed, meaning it's starting to break apart inside the tooth. And then I've got another root canal here, and this is going up in my sinus, and lo and behold, on the CT scan I had for another issue, which thankfully was not a big deal, there's just gras sitting in my sinus, and the root tip disappears in there. So why am I telling you this? How does this actually relate to dogs and cats? This is the deal. We know that dogs and cats with bad teeth have other health diseases, and we know for sure heart disease, and we know for sure kidney disease, and probably liver disease. The idea is that those 3 organs receive the vast majority of blood flow with each heartbeat. So that's scary. So now what do? From day one, get your puppy, get your kitten used to you getting inside their mouth. So brushing the teeth is always the best way to go. Feeding food like home-cooked food or raw food, so home-cooked food like the original Crock Pet Diet, makes them loll the food around in their mouth. They produce a ton of saliva, and then that saliva actually has antimicrobial properties in the mouth, which is cool. Give them bones to chew on. Don't give a 12-year-old dog bones if they've never had them before, because it's very likely they will fracture teeth. Raw bones, not cooked bones. Those are the ones that are safe for them to gnaw on and not splinter. So again, start your puppy, start your kitten young. For cats, sometimes they are more accepting of things like chicken gizzards. Those are great chew items. And brushing again, I would be lying if I told you I brush all 6 of my pets' teeth. I'm sorry, I don't. It's just one of those things I never quite get to. But what can be very helpful is something like plaque off, which is a particular species of kelp that helps to reduce the bad bacteria in the mouth and encourages growth of good bacteria. And that's really simple. You sprinkle a small amount of it onto the food, and then boom, you're off to the races. So that's what I got for you today. I saw a ton of comments. I'm going to scroll back through. I think there's a couple of questions in there. But dental care is imperative, because the thing that used to drive me insane is every year I'd talk to a client and say, okay, we're getting some dental tartar. We really need to get that cleaned off. And dental procedures in dogs and cats are scary because it does require general anesthesia. But, they say, no, I'm really scared of the anesthesia. And so finally, here's this dog at 10, and it now has teeth that are about ready to fall out of its mouth, and other teeth that have like an eighth or a quarter of an inch of tartar on them. So we've got no idea what we're getting into once we clean them up. So start early. Yeah, it's expensive, but if things are not good, you are going to save your pets so much pain and provide them, help them keep their teeth and keep them healthier. So Patty's talking about she's had endocarditis and she needs a new heart valve. And yeah, that is exactly where all of that stuff comes from. The bacteria is in the mouth. If the teeth get abscessed, 80% of the time in dogs and cats, we never know it because the abscess drains into the bone. Rarely we'll see an abscess come up under the eye. So, but in the meantime, your pet has spent somewhere between 6 months and a year or 2 years or 3 years, or in some cases 5 years, with painful abscessed teeth in their mouths. So really pay attention. We look at these teeth because it's easy when we're looking at dogs and cats' mouths, but this is really where the trouble is. So pull the lip all the way back. Look at these molars. If their breath is knocking you over when you do that, that's a sign that they really, really, really need help. So Patty is telling the truth. I mean, you let this stuff go and then you end up with problems down the road. And so that's what I know. I'm going to get a couple of questions. So Tia is saying is that her dog all of a sudden can't see and she doesn't know why, and she's 12 years old. So there's a whole host of reasons that could be. Dogs and cats get macular degeneration. They get retinal atrophy, and all of these things can come on very suddenly. And then, frankly, they also, as they age, their vision gets worse. Sometimes they have cataracts. Sometimes they have severe lenticular sclerosis, which is an aging change. But for Esau, he's 15, I have to turn the lights on now for him to go down. But Tia, I think the best thing is to go get that checked out and make sure that there's not something like a retinal detachment present, which can be caused by high blood pressure. So your vet can help you out with that and do a thorough ophthalmologic exam. And Allison's saying she just has been cooking for her dogs for about 6 months. And she's got some general questions about the diet, and I cannot see the rest of that comment, Allison. I'm sorry. If you've purchased the Crock Pet Diet membership, then the best place to put those questions are in that private Facebook group, and we'll get them answered for you there. So Allison, if you want to try to type in the whatever you've said after curious about, I will try to answer that for you. And Julie's saying that her little girl's got an ear infection that won't seem to clear up. The most common cause of a chronic ear infection is the first ear infection never got completely resolved. So, if it's been going on and on and on, the best way I can tell you to approach that is to find a veterinarian that can flush your dog's ear out under anesthesia. Get a culture and sensitivity so you know exactly what antibiotic may be appropriate and if it truly is a bacterial infection present. And understand that once your vet flushes the ear out, I mean, when I did this in practice, we'd see years of Otomax coming up. So, putting the medicine in is one thing, but if you don't flush it back out and clean all the gunk out, it just sits there. And then more importantly, with dogs with chronic ear infection in particular, and some cats as well, that eardrum is a really thin membrane. If everything's inflamed and all ticked off down there, often what happens is the eardrum ruptures and gunk gets down into the middle ear. You start to get the external ear canal cleaned up, and then that eardrum seals over, sealing all the grossness and bacterial infection inside, and then it ruptures back out. So Julie, get that checked out. The other key thing is that often allergies, whether it's food sensitivities or environmental allergens, are at play here. And so making sure that those are covered either with diet, and this is where my gut health program actually may be of great help to you and your pup. If you can get your gut to stop reacting to what you're eating, and same thing for dogs, then your burden of inflammation goes down dramatically. If it's related to allergies, quercetin and stinging nettles is an amazing thing. So Allerol is a product I've been using for years, which has offered spectacular results. So hope that makes sense. Let's see what else we got here. And Gilbert's asking, what do you feed a dog that won't eat any dog food of any kind? Feed it the original Crock Pet Diet, because it's real food. And you can alter that recipe to make sure it's what's going to serve your pet best. So both dogs and cats, although certainly cats can be really tricky. Patty Thomas is writing in about a Maltese that she rescued, and is at 13, had a ton of teeth removed, because Patty's a good person and is taking care of this pup. And so needless to say, this pup is not excited about brushing, and who can blame her? Her mouth has been painful for a long time. So what I would do is take the path of least resistance. So try some plaque off. The other thing you may try is just taking some baby food, and we used to say pantyhose, which this tells you how old I am. I don't think they even make these anymore. But anyway, something that's got a little bit of a rough texture with it. You can get the little finger brushes for infants. Those are awesome. Put a tiny amount of baby food on that finger brush, and just, come here into the easy part that she's letting you get to without any discomfort. Go for 2 or 3 seconds. She gets that taste of food. Build up your time every day. Just go really slow. Her mouth has hurt for a long time, probably. Good for you for taking care of her and getting her healthy and comfortable. And I think that's all the questions we've got today. I can't tell you guys how excited I am that we've got so many folks on the broadcast this week. So, tell your friends that this is what we do. I'm trying to help you answer questions that you're not able to get answers to either from your regular veterinarian. Go check out the original crockpetdiet.com. I've got several information products that are kind of a DIY approach to incorporating holistic medicine options for kidney disease and gut health, which is truly the underpinning of health. And so that's what we do. And Carol has one more question in there, that she says she's got a dog that leaks on the carpet no matter where she lays. And what can she do? And so the first thing is to make sure that there is not a urinary tract infection present, and also bladder stones. So again, talk with your veterinarian, get a urinalysis done, get a bladder ultrasound done to make sure that there's not some physical problem there. And then if that doesn't work, I would, frankly, many people were able to take their animals off of Proin or DES, which are medications that are used to treat urinary incontinence after starting the Crock Pet Diet. So, I keep saying this, but this is the truth. Food is the basis of health, and it's why I always end this show saying that your pet's best health starts in the bowl, because it is the truth. So, guys, that's what I've got for today. Thank you for coming and joining me today. I'll pin this video to the top of the page, so you can share that with friends. Thank you for sharing this video while we're broadcasting. I'll put links again for that awesome medical device for people with opioid addictions, the link for the Animal Wellness Summit, which is going to go on until the 20th of November. And actually, my presentation is the 20th, along with my colleague and friend Will Falconer's presentation about how homeopathy is so important in natural rearing. So the speakers today again are Dr. Dodds. There's several presentations on seizures in birds, horses, and just all sorts of cool stuff on this thing. So go check it out. Strongly consider purchasing that app pass because, again, you're going to get more value aside from just the presentations as far as being able to ask questions and get answers from the experts that have created these presentations and have given them to you. So, and I'll put a link for that too. So again, take good care, have an awesome week, give your pups a hug, and remember, your pet's best health truly does start in the bowl. Thanks.